Welcome to the AdventHealth Transplant Institute. Patient Education for Kidney Transplant. What to know before transplant while waiting on the list. At AdventHealth Transplant Institute, we have experience and a rich community history. At AdventHealth Porter, we have decades of dedicated transplant experience. In 1988, our first kidney transplant was performed at what was known as Porter Adventist Hospital. Since then, we've added other transplant programs and continue to grow our expertise as the AdventHealth Transplant Institute. This is AdventHealth Porter. Every year during Donate Life Month in April, we fly a flag to commemorate donations from organ donor families. When you are added to the waiting list for a kidney transplant, your case is assigned to a transplant team that includes transplant coordinator, transplant assistant, transplant financial coordinator, transplant licensed clinical social worker, transplant registered dietitian, transplant surgeon, transplant nephrologist, transplant pharmacist, and we also have available transplant psychiatrist. Transplantation can provide a better quality of life when compared to dialysis, but it requires a commitment to lifelong habits that will help reduce the risk of kidney rejection. It's important to know that a transplant is a treatment option, not a cure. What to expect on the waiting list? How does the waiting list work? United Network for Organ Sharing, UNOS. It's important to note that kidney allocation is controlled by the United Network for Organ Sharing, or UNOS, and not the AdventHealth Transplant Institute. UNOS is a not-for-profit organization under contract with the Department of Health and Human Services to maintain the National Organ Waiting List. They monitor every organ match to ensure that organ allocation policies are followed. Qualifying for waiting time. Once you're on the kidney transplant list, you'll begin to collect wait time based on the following: the date you were put on the list with an eGFR of less than 20. Recall that the eGFR is the blood test that determines your kidney function. Or the date you started dialysis, whichever is earliest. Estimated Patient Transplant Survival, EPTS score. As a transplant candidate, you will receive an Estimated Patient Transplant Survival score, or EPTS. Your EPTS score is calculated by UNOS and based on your age, the length of time you've been on dialysis, if you have had a previous transplant, and if you have a current diagnosis of diabetes. You'll receive your score when you meet with your transplant care team. Estimated Patient Transplant Survival, EPTS score. This score is associated with how long you will need to have the kidney functioning after transplant. For example, a candidate with a score of 20% will likely need a kidney longer than 80% of other candidates. This is true for much younger patients that will require a transplant to function through more of their lifetime. Kidney Donor Profile Index, KDPI score. Every deceased donor kidney is given a Kidney Donor Profile Index score, or KDPI. The KDPI is based on a score of 0 to 100%, which is associated with how long the kidney is likely to function after transplantation. For example, a KDPI score of 20% predicts the kidney is likely to function longer than 80% of other available kidneys. Kidney Donor Profile Index, KDPI score. The score is calculated based on the donor's age, height, weight, whether stroke was the cause of death, if the donor had a history of hypertension or diabetes, if they died due to loss of heart function or loss of brain function, and their creatinine level. KDPI and EPTS. These two scores are then fitted to one another in UNOS according to the need of the patient and the quality of the organ. Kidneys with a KDPI score in the higher range, such as greater than 85%, do not mean they are not good organs, but may be best matched to patients who are older, as they may decrease waiting time and expand your pool of options. Patients will need to consent to being offered kidneys in this range, and our physician team can provide more detailed information when you are seen. Kidneys with a KDPI score at or below 20% will be offered first to candidates with an EPTS score at or below 20%. This commonly includes pediatric patients and young adults. Matching. There are many other factors that are taken into consideration when matching organs to recipients, such as blood type, tissue matching, and patients with high antibody levels. Our team focuses on making sure we match each patient to the right organ for them. Our highest priority is giving each person the maximum potential for a successful transplant and long-term health. Donor risk behaviors. All donors are screened for infection risks at the time of organ or blood donation. An example of these risks may include donors that have used drugs or were in jail within 30 days of the donation. Due to the shortage of organs for transplant, all possible donors should be considered for transplant. Before considering an organ that presents with risk criteria, please be aware that the risk for undetected infections like HIV, hepatitis B virus, or hepatitis C virus infection is extremely low, since the testing used is very sensitive at picking up these infections. All transplant recipients will be tested for HIV, hepatitis B virus, or hepatitis C virus after transplantation, and should transmission occur, effective therapies are available. Hepatitis C positive donors. Deceased donors that are known to be infected with hepatitis C virus can be good donors. Accepting an organ from a donor who is infected with hepatitis C virus, HCV, may allow you to have a transplant sooner than if you waited for a donor who does not have HCV. Current treatments for HCV is very effective, curing over 98% of patients. Your transplant physician will speak to you about this option in detail, and a consent to be offered these organs will need to be signed. Waiting on the list. What can you do to keep up? Your responsibilities while waiting. There are many factors that could affect your time on the transplant waitlist. After you have been added to the list, you will be expected to communicate to your coordinator if you have experienced any of the following: if you move or have any changes in contact phone numbers, if you start or change dialysis centers, if you change or lose your insurance, if you're hospitalized or diagnosed with any serious illness, if you receive any blood transfusions, and if your caregiver plan changes. Waitlist requirements. All patients on the waitlist are required to complete either a 6-month or annual appointment and testing with our transplant team. Outside testing will also be required to be updated, such as cardiac follow-up testing, nuclear stress test and echo, and imaging. A CT is performed annually for our diabetic patients. We will also want you to maintain your routine health screenings and cancer screenings, such as pap smear, mammogram, and colonoscopy. Completing appointments as scheduled will help you stay on track and active on the list. Psychosocial update. During the psychosocial appointment by the transplant social worker, you will review again the role of your identified caregivers and the need for putting this plan in writing. The social worker will discuss any mental health history, substance use, employment status, living arrangements, coping mechanisms, and your readiness to undergo surgery. Financial update. During the financial review by the transplant financial coordinator, your insurance provider will be contacted and a request made to obtain authorization to keep you on the waiting list and for the annual testing requirements. Depending on your coverages, you may have been asked to show proof of savings, which should be set aside to cover any out-of-pocket costs that your insurance does not cover, such as hospital deductibles or medication copays. If you have had to utilize these funds for other purposes, we encourage you to connect with our finance team. Assistance programs could be available to help. All patients are encouraged to fundraise for out-of-pocket expenses as a great way to offset the cost of time away from work for you and/or your caregiver, as well as medication copays. Your responsibilities while waiting. Your waitlist responsibilities will also include sending in a monthly blood sample. Kits will be provided to you or to your dialysis center, who can help collect blood samples. Having a monthly sample will ensure we can start compatibility testing as soon as an organ becomes available and helps you avoid being passed over for a potential transplant. And inactive or hold. There are many reasons why we may need to place you on an inactive or hold status on the wait list. If this happens, you will continue collecting wait time while on hold. Changes to insurance where new auth is needed. Changes to caregiver plans or no caregiver. If you are sick or hospitalized for any reason. If you are having another type of surgery. Updated testing is now abnormal or concerning. More testing is needed to confirm you are still a candidate. If you develop an infection or have an open wound. When the issue is resolved, our team will decide when you can be cleared to be reactivated on the list. Your safety is our top priority. Living donation. Benefits of living donation and avoiding the wait. When you're on the kidney transplant list, you can wait for a deceased donor or find a living donor willing to give this generous gift. A living donor can be a spouse, parent, child, sibling, close friend, coworker, church member, neighbor, or anyone who is willing to be screened for eligibility and then tested for compatibility. This is the best way to get a kidney sooner rather than later. Benefits of living donation. Living donor kidneys last twice as long, on average, as deceased donor kidneys. Living donor surgery can be scheduled in advance, which allows you time for planning and coordination of recovery care. The cost of the living donor evaluation, surgery, and hospital stay are covered under the organ recipient's insurance. Paired donation. If you have a person willing to donate, but they are not the right blood type, size, or age match, or compatible to you, swapping donors and paired kidney donation can help. We work closely with the National Kidney Registry to find the best match for you and your donor. In this slide, you'll see a paired donation chain example. Kidney transplant surgery and recovery. What to expect in the hospital and long after. Kidney transplant surgery generally takes 3 to 4 hours. The donor kidney will be placed in your pelvic area on either the right or left side with a 5 to 6 inch incision. After surgery, you'll be admitted to the transplant floor where you'll recover for 4 to 5 days. Leave multiple calls before you get the one. Be prepared to answer the call. If you do not respond, we may have to go to the next patient. Sometimes 4 to 5 patients may be called for one kidney to ensure there are patients available as a backup. If things have changed and you are not ready for a transplant for any reason, loss of a caregiver, change in insurance, not feeling well, you may need to wait until you are ready. Stent placement and removal. All kidney transplant patients have a ureteral stent placed during surgery. The stent is a flexible tube that has a curl at both ends and sits in the ureter. It allows urine to drain freely from the kidney to the bladder and helps prevent urine leaks. The stent will need to be removed about 2 to 4 weeks after surgery in an outpatient procedure. You'll be given further instructions regarding the stent after your transplant. Potential complications of transplant surgery. With any surgery, complications can occur. Possible surgical complications associated with transplantation include thrombosis or blood clot, stenosis or narrowing of the renal artery, obstruction or stenosis of the ureter, urine leak, incision infection, and viral or bacterial infection. Complications and rejection. Transplant complications can also occur if your body rejects the new kidney. Acute rejection is usually experienced in the first year after transplant. It may be treatable if caught early. This requires more testing like labs, a kidney biopsy, and sometimes hospitalization so IV medication can be given. Chronic rejection may occur years after the transplant. It has a slower onset and treatment is less effective. Close monitoring and follow-up care over the years can help to prevent or delay losing the kidney in the long run. Hospitalization and discharge. The entire transplant team will be caring for you in the hospital, including the transplant social worker, dietitian, transplant nephrologist, transplant surgeon, and our transplant APPs, which are either advanced practice nurses or physician assistants. The transplant coordinator will be providing specialized discharge teaching to ensure you have the tools to care for yourself at home. Transplant follow-up. After you're discharged from the hospital, you will be required to follow up in the post-transplant clinic to be monitored for acute rejection and infections and have medications adjusted if needed. Medications. Part of your post-surgical care includes taking immunosuppressants that will help reduce the likelihood of rejection. These must be taken for as long as you have your transplanted organ. Common medications, thymoglobulin IV, given during surgery and in the hospital, tacrolimus or Prograft, or its extended release Envarsus XR, mycophenolate mofetil or Celcept. Some patients can develop diabetes due to the combination of medications for a short time after transplant that requires blood sugar checks at home and taking insulin. You'll also be prescribed medications that will help minimize certain side effects associated with the transplant. These prophylactic medications are taken temporarily, usually anywhere from 3 months to 1 year post-transplant. Valganciclovir or Valsite, an antiviral, and Septra, an antibiotic. Medications. You must be able to afford your medications post-transplant, so it's important that you're aware of what your insurance will cover. Talk to your transplant financial coordinator before making any changes to your prescription coverage so that you know how it will affect you getting your medications. Patient assistant programs could be available to you in times of hardship. Our team can help guide you over the years. Our goal is for your new kidney to last as long as possible for years to come. Interactions. Check with the transplant team before you take any over-the-counter medication or medication not prescribed by us, so that we can advise if this will interact with your immunosuppressants. Do not take any herbal supplements without consulting the team, as many supplements such as turmeric can interfere with your immunosuppression medication. Our transplant dietitian will also advise on what foods to avoid that can interact with your medications, such as starfruit, pomegranate, ginger, and grapefruit. A commitment to the medication and lifestyle changes directed by your care team will help ensure you stay healthy for many years to come.